First, to back here in New Zealand. Overnight, we switched to the next stage of our Omicron response, phase 3. So what does that actually mean? Well, now, only confirmed cases and their household contacts are required to isolate. Any other contacts don't have to isolate, but they do have to monitor for symptoms and get tested if they get sick. Rapid antigen tests are now the main form of testing in the community to ease pressure on labs, so priority PCR tests can be carried out. RATs will also be available from GPs and pharmacies in coming days and will be sold in some retail outlets from March. To help us navigate this new phase and provide her expertise on managing COVID from home, I'm very pleased to be joined now by General Practitioner Dr. Sandhya Ramanathan this morning for more on this. Morena, Dr. Ramanathan, thank you so much for joining us. We really appreciate it.
Morena, Matty.
How are you going? Because it's a crazy time out there, isn't it?
Yeah, that's an understatement. So I'm doing well, but yes, we are burning the candle at both ends in general practice at the moment and surviving on very little fuel. So yeah, we are trying our best to keep our head above water and keep the head above water of all our patients as well.
Yeah, how different is this for you and for your colleagues as opposed to the last couple of years? Because obviously this has been a very long pandemic already. How different is the phase that we're in at the moment for you?
I guess New Zealand's in a pretty good place in that now we're in the third year of the pandemic, and while as GPs and medical professionals we've been dealing with a tsunami of information for over 2 years now, the actual tsunami of cases is only starting now. And thankfully, because of our really high vaccination rates in New Zealand, we're hoping that rather than a tsunami, it's just going to be a large wave, and we're going to be able to really mitigate the impact of this Omicron outbreak.
You talk about a tsunami of information, and I know there's been some concern from medical practitioners about just how rapidly that information is changing for you and how you keep up with what exactly it is that you're required to do. Yeah,
I mean, currently it feels like we're in a bit of a circus act, and we're sort of being, as GPs, asked to sort of juggle many balls while standing on top of our head, and sometimes only being thrown peanuts for our efforts. But yeah, we are getting information thick and fast. You know, we're getting 2 or 3 updates a day where we have a lot of information to go through. Just last night we had an hour and a half update where we were getting the latest information about what's going on, and sometimes we're finding out at the same time as the general public. So, for example, with now the switch to mainly rat testing, which is good, we welcome that. We as GPs were only just receiving our supplies now, so we really need our patient population to remain very patient and calm while we try and get our supplies and sort through who qualifies for the test.
The switch to rats, though, is that going to ease some of the burden that's been put on medical practitioners in terms of I know that there was a lot of lag between PCR tests being done and those results being found out.
Absolutely. The benefit of the rat testing is that the results are available within 15 minutes. They're not as sensitive as the PCR test, but definitely that will ensure that people that should be isolating will find out straight away. The only problem with that is the test is only as good as the sample that's being taken. So it's really important that people go online. Health Navigator is a great site. There's a lot of very helpful videos. I understand you also did a good demonstration, but that you're taking an adequate sample. And just an important piece of information is that they're not children under the age of 6 months cannot have a rat test, but parents are able to do it to their children. And a nice way is just, having them sitting on your lap with them slightly looking up at you, and then, just taking the sample. And a really good tip from an Australian ENT is go low and go slow, because your nasal cavity goes back and down, not up.
Yes,
so
that was the biggest thing for me, because when I did my rat test the other day, I think everyone's natural inclination is to go up the nose.
Yeah, but you actually got to point it back towards
like a 90-degree angle, almost, isn't it?
Yeah, and just slightly tilt your head up and just point it back. So go low, go slow, and just 5 twirls around that area. And the important thing is not to eat or drink or smoke for 30 minutes before the test, and just follow the instructions for self-reporting on your My COVID record, or there is a phone line that you can call to report that as well.
I feel like we're kind of only just scratching the surface with the case numbers. I mean, they seem to be exploding, but obviously there's a bit of a lag with testing. So how concerned are you that actually there's so many more cases out there than what's being reported?
That's a given. Because 50% of the cases will probably be asymptomatic, especially in a highly vaccinated population. So that's why, as GPs, we have to take all precautions, or in healthcare settings, and assume everybody is COVID positive, and so that we protect our most vulnerable patients. Now, I guess the biggest mentality change for all of New Zealand in phase 3 is that it really tips to a self-management phase, where the responsibility is no longer with other people, the responsibility relies on ourselves. And I spoke to you the year before last, Matty, because I made a video on how to manage COVID at home, mild COVID at home, which I've been blessed that it's had a huge global impact and has helped millions of people around the world. And I think since I've spoken to you, I've got it in 16 other languages.
Wow.
So this is my now thumbnail of exactly how many versions of my video, my 18-minute video, where I basically describe a 3-step plan. It starts basically with explaining the pulse oximetry, and then I go through how you prime and boost your immune system, how you reduce your viral load, and how you do breathing exercises and positioning to improve your oxygen saturation. So based on my video, actually quite early, one of the pharmacies in Lower Hutt actually made a really cool COVID kit, and I just brought this in because it's really useful for if everybody stays really well prepared, then all of New Zealand's going to do a lot better if each individual takes their responsibility. So, yeah.
Yeah, so stay calm, stay prepared, and stay patient.
Stay patient, yeah, absolutely.
Hey, thank you so much for your time this morning. We really appreciate it. That is GP Dr. Sandhya Ramanathan. We really appreciate your time this morning.
Thank you, Maddie. Thanks for having me.